Hello, hello, hello. So, good day, sir. So, this is my final project. So, this is my website, and this is for breast cancer diagnosis and analysis platform. So, let's move to the visualization. Okay, here. So, let's go to the to my dataset CSV before it. This is I think this. Don't know if I need this. So I'm gonna explain, or I'll just graph first the datasets from my CSV. So this is the histograms of age and tumor distribution. The age distribution shows an average age of 39.8 years among 213 patients. Tumor size distribution indicate an average tumor size 4.3 centimeter, which helps in understanding the stage and severity of classes in the dataset. And let's go to the categorical data distribution, the charts. The menopause status. Among 213 patients, 66.7% are postmenopausal. Postmenopausal status is associated with increased breast cancer risk due to hormonal changes. And the metastasis, metastasis, stasis present in 34.3% of 213 cases. Low metastasis rate suggests early detection, which is crucial for better treatment outcomes and survival rates. And let's go to the family history. Family history of cancer present in 41.3% of 213 patients. Family history indicates the genetic predisposition and helps in risk assessment and screening recommendations. And the breast side, or the breast side distribution. Among 208 cases, 51.4% occur in the left breast and 48.6 in the right breast. This distribution helps understand tumor laterality patterns in the population. And the diagnosis result, 213 cases, 56.3% are benign or non-cancerous, and 43.7 are malignant cancers. This ratio indicates the cancer detection in the data. So, in this dataset or in the CSV, there is no normal result. So there is two result. So it's benign or the malignant. So let's go now to the trained CSV model. So this is the model performance review. So this is the actual screenshot. So there is overall accuracy is 91.5 or 94.8, 91.48. Then trust validation accuracy 94.1. So class-wise analysis, class 0 is the benign. Precision 85% of all prediction benign cases, 85% were actually benign. And the 94% all actual cases, 94% were correctly identified. 89% balance measure precision recall and support 18 samples. And class 1 or the malignant, its precision is 96 and the recall is 90% and the F1 score is 88. The model effectively identifies malignant cases, reducing false negative, crucial for patient safety. Low false positive, minimize unnecessary anxiety and procedures for benign cases. So here is the key training insights. So I use motor convergence training shows successful conversions with stable loss reduction. Feature extraction using VGG16 pre-trained weights effectively. Extract medical image. Oh, see, this is for other one. Smooth production. And this is the confusion matrix. And let's go to the other one, to the image. So this is the image processing. So here there is normal. There's normal result by diagnosis. So all the data set is from the Kaggle reference here. So use the scalar accuracy. Then this the image model training curves and the model confusion matrix. So let's go now to the prediction. So first, let's go to the clinical data analysis. Click on to uh, middle moderate risk. Why this protection? Risk factors. Age factor, middle age 40 to 60 represent a moderate risk. And the tumor size, medium tumor size is 2.5 centimeter. And the lymph, 1 to 3 lymph nodes suggest regional spread or aggressive treatment. And the hormonal factor, if you are menopause, affects hormonal levels which can influence cancer rate. Uh, no detectable metastasis suggests localized disease improvement. No family reduced genetic risk factor. Let's go now. Let's try. Okay. Of course, not yet. Let's put zero. Uh, small zero and put the right. No, and family. So I think this is normal, but of course I don't have normal diagnosis. Younger age under 40 is generally associated with lower breast cancer risk, though aggressive forms can occur. Small tumor size typically indicates early stage cancer with better prognosis if malignant. No, in bold indicates disease without nodal. Premenopause indicates active hormone production affecting cancer characteristics and treatment approach. We know. And of course, family history, increased risk. Positive family history, increased genetic predisposition and overall risk assessment. And there's clinical recommendations. Routine, routine monitoring, continue regular screening schedule, follow up, risk reduction, maintain healthy awareness, monitor for any new symptoms and reassurance. Current indicators suggest field condition. So let's go now to the image. By the way, yeah, first of all, I put two different results. because in the data set that I get in a Kaggle, there is the original and also the mask version. So that's why I put it here. So original, it has just 69%, and when it mask is 99.2%. Analysis comparison, same prediction, AI model information. So VG16, and of course, this is analysis method, dual prediction, original plus mask. And why this prediction? Visual analysis factors, moderate confidence, and consistent focus. And now let's try to upload different file or different images. And yet this one, the as you can see, this is the image for tumor. So it has a big tumor. I think this is a tumor now. But let's do other. So this is normal because as you can see in the mask version, it has no highlights. Let's let's upload to tumor. So this is benign. So benign is non-cancerous. It has like a small, I think like small circle or small tumor. You can see the mask version. And last, as you can see here, this is why I put two different. But the actual the actual image is benign. My mask version is not that perfectly accurate. So I'm gonna show you my data sets. Right. So this is the data set from Eagle. So let's do first the non-cancerous. So I use 80% for trained and 20% test. So as you can see, the beginning is just a circle, like oval like that. And the malignant is like a irregular shape. And the normal is, as you can see, if it mask, it's just black. And that's all, sir, for my final. Thank you.